Hey guys, welcome back
Hello.
to our channel, All Around Health Talk. Today we're going to be talking about possible treatment options for the COVID-19 disease. All around the world, since the beginning of this pandemic, there have been different drug trials as to finding a cure for the COVID-19 disease. We've had different drug trials in countries like China, France, US, and even Cuba as to find treatments for this COVID-19 disease, and also drug trials to find a vaccine in the cases of countries like Israel. And there have been successes that have been recorded due to the usage of some drugs. And these drugs are, I'm sure we've heard of lots of them going around on social media, like the chloroquine or the hydroxychloroquine, the remdesivir, drugs like ritonavir, which are like more like antiviral drugs, and the azithromycin, zinc sulfate. So these are like different drugs that have been tried according to different countries. For example, in China, they're currently using a cocktail that comprises of chloroquine and the chloroquine and remdesivir. And in France, they've been using drugs like the hydroxychloroquine or chloroquine with azithromycin and zinc sulfate. And even Cuba, who have tried to use the alpha interferon to help treat this disease. So these are treatment options that are still in the trial stage. Now I understand that this might be it tends to be misinterpreted by some people, and they start going to buy and they hoard drugs. But number one, you need to know that these treatment options are just that, treatment options, possible treatment options. They are in no way to be used as prevention methods, because as of late there is no prevention for coronavirus disease. All you have to do to help prevent the transmission of this disease is by the social distancing, practicing hygiene, hand hygiene, respiratory hygiene, and stay home, not in order not to infect other people, or in order not to risk getting infected yourself. So these right now are the only preventive measures we have against the COVID-19 disease. But the drugs that I just mentioned right now is only for treatment options, which means if you do not have COVID-19, please and please, there is no need for you to go crazy buying these drugs or even hoarding them, because you would be reducing the access that the people who really need these drugs have to these drugs. So please, this is only for treatment options, possible treatment options, because there hasn't been any approval yet, because these drugs we still have a lot to understand about the disease. We still have a lot to understand about how this disease relates with these drugs. So there is a lot that we do not know yet. So these drugs are still in the trial or testing stage.
Okay, and even if you have COVID-19, because there are cases of people who have COVID-19 because they have very light symptoms, they send you to stay at home and just self-isolate. It doesn't mean that you still need to buy these drugs. Okay,
Exactly.
these drugs are only applied by doctors, people who are already certified medical practitioners. They're the only ones who can administer these drugs based on your symptoms. Okay, now going back to the trial, World Health Organization is also studying certain drugs too, basically the same drugs that she has mentioned, but they are doing something that is called the Solidarity Trial. On a normal day for a clinical trial, there are just so many steps that if right now World Health Organization decides to follow those steps, by next year we'll still
We're
not
still not
be ready
anywhere.
to treat anybody with COVID-19. So World Health Organization is doing something they are calling Solidarity Trial, which means these drugs are being tested directly on the patients who are sick. Because on a normal day first they have to do the in vitro in
In
tubes, and then they
vitro,
just
yeah.
keep going stage by stage and
Yeah.
stage by stage, and that takes a very long time. But right now, to hasten everything, World Health Organization is working on the Solidarity Trial, where with the consent of the patient they are trying these different drugs on the patient to see which one of them actually works. Now, like she said, these drugs have been tried in different countries. Now, some of these drugs are working in certain places and are not working in other places. For example, interferon is what is working in Cuba.
Yeah.
Right? They're not trying chloroquine and hydroxychloroquine. They're working with interferon because that's what's working for them. Now, the fact that these drugs are working or are showing promise doesn't mean that people who have been treated with them have not died. Okay, just that there are more people who have survived after being treated with these drugs, but there are people who have also died even with the hydroxychloroquine and every other thing. So, like right now, none of these drugs are approved. They are just possible because right now we just have to try. We just have to try what we have to see if the patients can survive. It's not like any of them has been approved. None of them have been approved yet. Okay, so right now the tricky thing here is that even the doctors are still trying to figure out when to administer the medication. Now, there are all these drugs that have shown promise, but the problem is, when do you administer the drug for it to be effective? Because some cases they receive the drug when they're already in a severe stage, when they already have the pneumonia caused by COVID-19. So right now, doctors and scientists and researchers are trying to figure out when can you administer a certain drug for it to be effective. So the fact that, they've said that chloroquine is working for some people doesn't mean you have to buy, because you might take it and it doesn't work, because the timing has to be calculated perfectly well. And let's really, right now the world needs people who are going to show love and show consideration. Why are you buying chloroquine? You don't even have COVID.
You don't even have the disease.
Why? The fact is that chloroquine, we know Africans, it's used for malaria treatment, right? There's hydroxychloroquine. These drugs are also used for treating people with rheumatoid arthritis and lupus. So there are other people who need these drugs, and then you're buying it for what? You don't have anything. You're not a doctor. Wait, if you get sick, then the doctors will administer what you need. Let's stop being selfish. This is not the time to be selfish, people. Please, let's try to consider one another, and let's try to make the work of the doctors easier. Please. Everybody is saying, doctors, we love you, you people are superheroes and everything, but at the same time, you're making things difficult for all of us who are doctors. So please, I'm begging you, you don't have to buy chloroquine. It's not for prevention. The only way to prevent it is wash your hands, social distance yourself. If you have any respiratory symptoms, isolate yourself from other people. Those are the ways to prevent it. Right now, there is no treatment. There is only prevention, and the prevention is you.
Yeah.
Not chloroquine.
Right now, the vaccine is you. We are the vaccine for COVID-19.
And now for a vaccine to be ready, it takes about a year to 18 months. So we are far from a vaccine. What we can do is do our part. Okay, doctors are doing their part, researchers are doing their part, governments are doing their part. We as individuals, we have to do our part. Stay at home. Stay at home. I know it's difficult. People are used to going around and everything, but just stay at home for now. And hopefully this will pass soon, and then we'll go back to our normal life. So let's all try to help each other. Right now, we all need to be super, super, super considerate. Okay? There is no cure for COVID-19 at the moment. There is no specific treatment for COVID-19 at the moment. It's just trial and error. Okay, we'll try this. It doesn't work. Okay, so we'll try the next one.
Like that.
Don't go and be taking
that's the whole point of this video. Actually, I know that right now there's a lot of fear going on. People are panicking. People are even dying. People who don't even have the COVID-19 are doing stuff that are really fatal to them, that are killing them. People have died because of they took some substance that they thought was going to cure.
People are taking bleach.
COVID-19 that they don't even have yet. So the point of this video is to bring hope to you guys, that even in the midst of fear, the doctors and the health workers and the scientists and researchers are doing everything in their power to bring a cure or a vaccine to us, so that we're getting close. And we're getting close every day. But you need to help. But you need to help, and you need to be patient, and you need to just do the instruction that the WHO has already laid out for us, so that you can buy us time to be able to get a cure or get a standard treatment for this COVID-19 disease. So that's all we're asking of everyone.
Please. And this is not to scare anybody, okay? It will be fine by the grace of God, okay? Things will get better, but for now, let's just do our part. Let's just do what we can do to make this situation a little bit better for everybody. Okay, if you feel depressed, read a book, talk to your friends. You can chat on WhatsApp, you can do video calls, you can still keep in touch with people.
Even have group chats with Zoom.
Yeah.
Rant
if you're
on
at home
Twitter
and you
if you
don't know
want.
what to do, you
You
can
need
read
to,
a
like,
book,
vent
you can exercise.
somehow.
You know that this is the time for you to get that perfect body.
Exactly.
Like you can exercise morning, night, afternoon, whatever you want. You have the whole day to yourself, so you can exercise, and at the end of the day, at least you come out with this body that you've always wanted. So
COVID-19 revenge body. You should do that. COVID-19 revenge body challenge.
don't just be eating the food you have.
Yeah.
Manage the food, because we don't know how long you'll be stuck inside the house. Okay, so anyway, so we hope that you've been able to understand what's happening with the treatment options, and we hope that you watch this video, share it to other people, so that we don't have more people hoarding medications that other people really need. Okay, share the video, like the video, leave a comment if you want, and what else should they do?
Subscribe.
Follow us on Instagram too.
And
subscribe.
Just
Yeah,
like
the button is there. Subscribe so that you can get
it.
notification. Okay?
Yeah.
So that you can get notification.
Alert, not that kind of alert, but
Not financial alert, but this is also good.
it's also a good alert. So yeah,
I think we're talking too much. So see you next week. Bye.
Bye.